If you're anxious in your head, you can worry, but not all anxious people worry. There's some pretty scary physical symptoms associated with anxiety, and that's what I'm going to talk about today. I'm Dr. Tracy Marks, a psychiatrist, and I talk about mental health, education, and self-improvement. I produce weekly videos, so click subscribe so you don't miss one. I'll jump right in. You can think of anxiety as having two parts, a cognitive or thinking portion and a somatic or physical portion. If your anxiety is affecting your thoughts, you may worry a lot, or you may obsess about things. And it's normal to have some amount of worry. Let's say you fail a test. Are you going to get an F in the whole class? Or how will you pay your bills if you don't have a job? Things like that. But the worry that could be considered a disorder would be worrying about anything and everything, even if it's not a direct threat to you. And I always use the example of worrying about world peace. You can also over-worry about things that are a threat to you, such as a home invasion. This can happen to anyone, but if it's always on your mind and you can't stop thinking about it, and other more pleasant thoughts get blocked out because you're thinking about it, then it's over and above what would be expected, or what would be an expected response from someone without an anxiety disorder. A person can have anxiety without much going on in their heads in terms of distressing thoughts, and still have pretty severe anxiety. Here are some of the physical symptoms that they can experience, and they're not necessarily in order of severity. So you have heart palpitations. This is where you can feel your heart beating in your chest. And at rest, you should not feel your heart muscle contracting. If you do, it's palpitations. Shortness of breath, or feeling like you can't breathe. Lightheadedness or dizziness, and this is different from vertigo or spinning. This sensation, you may feel that the room is getting dark or you're going to lose consciousness at any moment. Then there's weak legs. Some people will say that they feel like their legs are just going to give way. Then there's chest and back pressure. Sometimes people will feel like they not only have chest pressure, but they also have pressure in their back. So it's like they're just being crushed from the outside. There's neck and shoulder pain, and this is usually from muscle tension, but it can be so painful that you may not make the association at the time. And so if you feel pain in your shoulder, you may think that you're having a heart attack, especially if you're one who tends to Google your symptoms. Then there's headaches and heat coming from the top of your head and your ears. I include this one as a scary one because often people will think something is seriously wrong with me, because that's not something people commonly say that they have. There's trouble swallowing, and this can be really scary. And this is not necessarily your throat closing, which you could see with a severe allergic reaction. It's usually more of just a lump in your throat when you swallow. And then there's cloudy, blurry, or tunnel vision. And usually anything visual can be quite frightening and not something you associate with anxiety, but it can be anxiety. So think of these physical symptoms as similar to what you would feel if a bear broke into your house and growled at you and stood on its hind legs. You'd probably feel your heart pounding, and you may even feel like you're just going to collapse and all kind of other things. Well, think about it. People with anxiety can feel this way all the time, even when they're sitting on a beach on vacation. With these symptoms, you don't have to have a trigger or reason to feel anxious. It can just come upon you. Keep in mind, all of these symptoms can be a part of another medical disorder. So you always want to see your doctor to make sure that something else isn't going on before you assume it's anxiety. In other words, if you've never had these symptoms before and now you start having them, medical problems should be ruled out first before someone concludes it's anxiety. What if it is an anxiety disorder? There's therapy options and/or medication, natural remedy options. How you treat it depends on the severity and the type of symptoms that you have. That's it for now. Thanks for making it all the way to the end. Don't forget to subscribe. See you soon.